One of the reasons why we do the work that we do is because the populations that we focus on right now have been historically underserved. And as I started out, I might talk, really pointing out the fact that there are social and biological elements to this disparity. And the reason why we have unmet needs from a biological perspective is because more than 80% of probably being generous with 80%, it's probably more like 95% of the biological information that we have about cancer has been derived from this homogenous population of primarily Europeans. And so there's sort of been this understanding or agreement, if you will, that cancer is cancer no matter who you are, to unify the world around cancer research. But at the same time, it's like it's not the same. Tumor progression is not the same. Even between different individuals, we know that no cancer diagnosis is the same. But unfortunately, because we didn't include diverse patients in the studies that now are the foundation of our knowledge base, we are missing huge gaps of information. And we see that translate in clinical settings by, for instance, cancer genetic testing having a higher rate in certain populations of finding a mutation, but not knowing what that mutation does. Like it's never been seen before. But we continue to see these mutations in certain populations. We call those variants of unknown significance. So it's a variant that's common, but it's unknown in the aspect of whether or not it's pathogenic because it wasn't discovered in the hundreds of thousands, millions even samples that were interrogated, because those samples were of, a different background, a genetic background. And so what I believe that our work it's already starting to bring more attention to the diversity in the patient population and how that can actually translate into unique tumor biology. And of course, this is important because then this may explain why certain treatments don't work in these populations. Genetic testing, genetic screening is not as effective in these populations. And so the first step is to bring awareness to that fact. And I think we finally checked that box. And it's actually been really difficult to pierce through the tradition of, not including certain groups for various reasons, mostly just convenience. And then secondly, because we're actually identifying not only that there are differences, but that these differences are targetable from a therapeutic perspective, that eventually some of the work that we're working on right now, for instance, is uncovering unique DNA repair pathways, which means here's a whole nother gene that could potentially be driving a unique pattern of mutations that could be indicative of a potential, drug that has yet to be developed, and put into clinic. And so that's what I hope our work is really going to, translate into. And I mean, of course, now that we're getting traction and we're starting to be accepted in major journals with some of our findings, and there's more awareness, there are more people working on it, and so now we see not only people focused on African Americans, but now we have groups focused on South Asians, Native Hawaiians, South Americans, Brazilians. So now we see sort of this cadre of scientists popping up, studying within their population, the biological diversities. And that's really cool. Like, I think that's really exciting. I try to make sure that I promote anything I see like that, because I think it's really important that we become more inclusive instead of trying to homogenize the data, to actually allow people to be who they are. And in that uniqueness, identify ways to better serve them clinically.